On September 29th and 30th, at the 2012 U.S. Conference on AIDS, the National Minority AIDS Council sponsored the pre-conference Summit to End AIDS in the U.S. We sat down with Lindsey, NMAC's Director of Legislative and Public Affairs, to learn more about the summit.
Early on, we decided when we were having our conversation around changing NMAC's mission from building leadership in communities of color to address the challenges of HIV and AIDS, we decided that we were going to seize the opportunity that seemed to be afforded with the advent of the Affordable Care Act and scientific advances like treatment as prevention and pre-exposure prophylaxis. We wanted to have a conversation with the community about what it would take to end the HIV/AIDS epidemic in America. When NMAC changed its mission to building leadership within communities of color to end the HIV/AIDS epidemic, we didn't want it to be lip service. We wanted it to be genuinely a commitment to the community to do whatever it takes by any means necessary, seize the opportunity of the moment, and really try to bring about an AIDS-free generation. I think the one thing that we really hope people walked away from this meeting with was information to go back home and make decisions about their own future in their organizations and their communities. We understand that we weren't going to be able to walk away with a consensus in 2 days, but we at least got everybody in the room to commit to the declaration to end HIV and AIDS, and that at least outlines the principles and the values that we need to incorporate in order to seize this opportunity, and I hope we gave them the tools to do that. The next steps for us after the summit are multi-fold. The first thing we're going to do is engage in at least 12 regional dialogues throughout the country over the next year, and I should be clear, in 2013, not necessarily starting in November of 2012, but in 2013 we're going to at least go to 12 different communities and engage their local providers and stakeholders in a conversation about what they're doing to change how they provide services to people at risk for and living with HIV and AIDS to move towards ending an HIV/AIDS epidemic. We recognize that everybody doesn't have the opportunity to travel. Meetings are hard. People have to take time off of work, particularly providers and clinicians really don't have a lot of time to engage in meetings oftentimes out of the clinic. So what we want to do is develop an online resource repository that's going to include webinars. It's going to include online resources to things like www.hivhealthreform.org, so people know exactly how health reform is impacting the HIV/AIDS community. We're also going to include other kinds of guidelines and other kinds of strategies that people have tried and tested in their communities. We recognize that we're at this incredible moment. We really have an opportunity to really change our approach to HIV/AIDS, build up the ability of people living with HIV/AIDS to improve their health outcomes and reduce their risk of transmitting their virus to others, and really bring about an AIDS-free generation. My name is Lindsey. I'm the Director of Legislative and Public Affairs for the National Minority AIDS Council.
To learn more about the National Minority AIDS Council and the U.S. Conference on AIDS, visit www.nmac.org.